I'm Claire Thetford, and I am a physician assistant, which means I'm a mid-level provider, and I technically could be, someone's primary care provider, right? I prescribe, I order tests, I do follow-ups, do pap smears, all that fun stuff, and I'm able to ask doctors that are within my pod any questions I might have. Yeah, I graduated from PA school, like I said, I can't believe it, like almost 5 years ago. And I started out in community mental health. And WNCCHS was a familiar name to me because I worked in South Asheville with a mental health population, trying to help them connect again with their physical health, because we know they both go hand in hand. And Minnie Jones was always listed as one of the old providers. So I knew the name, and really I was looking for a job right when you guys posted about the McDowell location, and I live in Old Fort and have been there for about 2 years now. And so I was like, okay, wait, this would allow me to go closer to my house and provide care there and be able to still see my similar patients here. Win-win. Community health is kind of an accumulation of things that can happen in a person over time, I feel like. And so whenever a patient steps in, it's really meeting them where they're at. And I love doing that. I didn't realize until clinical rotations that I really love the people piece of healthcare. And I think it's really important because otherwise a patient is going away and not really knowing what to do. And so in community health in particular, these patients have a lot of things accumulate over time. Lack of accessibility of care is a big proponent. And so when they come in here, I'm hoping to try to give them the most bang for their buck, if you will. Like, let's go through these problems that have been causing you to kind of feel this way, and see how I can help you understand what the disease processes are. And so education and patient education is one of my foremost passion projects. And when I tried, as I was looking for a new position after the community mental health, I saw WNCCHS and was like, this would be perfect. And it felt like I needed to be there. I kept saying that throughout my interview process too. The patient population really tugs at my heartstrings and they have a pull on me. And so I knew I needed to be in this sphere. It's been really great getting to know all of the team members. Everyone's going towards the same goal, if that makes any sense. In community mental health and community health in general, we're both just like, let's strive to make the patient the best, meet them where they're at. And I feel like everyone at WNCCHS understands that assignment. And so being in a pod environment is really nice as a provider because all the providers are within the same goal. You have medical assistants, you've got people you can ask questions to, especially as you're getting started. I love that there's behavioral health incorporated in, there's therapy services incorporated in, case management. All of those are things as a provider I used to have to outsource, right? And now it's all within one wheelhouse, and that's been amazing.